In this podcast, we'll be diving into the stuff they don't teach you in medical school. I did fail on my finals during medical school, and they taught me in the hard way. Medical school, they won't teach you that.
The best doctors are those that can talk to the patients in a way that a child can understand.
Working as a doctor is an art. It's not a checklist.
Hi, and welcome back to today's episode of Minds Over Scrubs. My name is Eirik Kjønfjord. As usual, I have my sidekick Ify with me.
Yeah, hello.
Hello. Today we're going to talk about medical school and what it teaches you, and maybe also the most important thing, what medical school don't teach or cannot teach. So, Ify, when you started medical school, you need really good grades and you think you are the best in the world. And then you start, especially me, start at a university with a lot of other phenomenal students. How did you feel about that?
Well, first of all, I was really happy when I get into the medical school, but being surrounded with a lot of smart people too was really unexpected, I would say, because when I, from my experience, before attending the medical school, when we were going to work in groups, there were always someone in that group who didn't do anything, and they, their lack of moral and their lack of skills in presentation or just helping in the group was really, really frustrating. But when I started in the medical school, most of the people there were really they really wanted to help in the group. It was really different for me, and I think what was the most different part for me was that they were even more brighter than me, because when you're in the school, you might be one of the top 1, 2, 3, or 4 students. But then when you're attending the medical school, everyone who got into this medical school is brilliant people. So who are you in this crowd? So for me, I think I was surrounded with a lot of different people, but really bright people in different ways. But yeah, so for me, it was really unexpected. What about you?
I think that the most eye-opening thing for me was that some of the brightest or most book-read people were not going to be the best doctors. I think that maybe the education form or the grades to get into medical school don't take part of what being a doctor is, because you don't need to have the best grades to become the best doctors. You need emotions, empathy, trust, talking to other people, liking other people, to become a good doctor. And that is something that I feel that is left out of the education in medicine, the communication part, how to talk to patients. Because when I went to medical school in Denmark, we were always told that you need to ask open questions, let the patient tell you as much as possible. But that's not how it works in the real life. If you ask an open question, most of my patients, they don't tell me a thing. Because they want open themselves until they get to know me and they get trust.
Yeah.
And that takes time. And usually you don't have the time, because when you are in the ER or whatever, it's the first and only time you see the patient. So that is one thing I learned in medical school that I couldn't use when I was a doctor in the real world. And another thing that I find a little bit strange is that when you read about diseases in medical school, you have a patient having those and those and those symptoms. But when you come out in the real world, many of our patients are elderly, they have more than one disease, and they are overlapping each other. So a symptom can cover another one. So you don't always find all the symptoms you read about in the book in the patients. And that can be difficult because the symptoms are masked. And that is something my father learned me, because he's also a doctor, and I've called in many times asking about patients and questions, and he says that, yeah, but I know this because I've been a doctor for many years. I have more experience. I've seen this before, and we did that the last time we had a patient like this. But that's not what it says in the book. So I think it's important to remember that medicine is sort of a master learning system. You need to see things, you need to experience things, and you need the experience to become a good doctor. You can read about the diseases, you can read about everything, and you need that backbone. But it's when you are finished with medical school, that's when the journey really starts.
And it's really funny when you're talking about that, because I was one of those people in medical school, bookworm, but I wasn't really good with a patient in the beginning. Well, at least I didn't think about it before I actually realized it. I wasn't the most brilliant medical student, I would say. People tend to ask me like, yeah, how did you do it and everything like that. And I'm like, you shouldn't ask me, you should ask someone else, because the way I did it was not probably the best way. And I think when I first attended the medical school, I was the same as you were talking right now, Eirik. I was just reading the diseases. I memorized it, every kind of clinical feature, clinical signs, every symptoms, and I could memorize it, no problem. And I remember that I got a comment from one of my during my finals, which is where it was an oral examination, and he told me like, you know everything from the book, but in clinical experience, there's a lot of missing points here. And I was like, what are you talking about? I read all the symptoms. The patient has all these symptoms besides this one. And he was like, yeah, but you're just memorizing them. You don't actually see your patient. You don't actually understand the mechanism behind it. And at that point, he didn't fail me. He said, under consideration, I will pass you, but you have to improve yourself. And I remember that moment. I was like, oh my God, it feels like I'm a failure right now. But then instead of thinking of I'm a failure, I was thinking of myself, okay, what can I learn from this? What can I do to improve myself as a doctor? Because when I told my mom, she was like, you have to take his piece of advice as a learning experience, as a positive message. Do not use this as a negative thought or experience. Use this as a positive experience so you can develop yourself. So what can you learn from this? And I was sitting there and I was like, okay, what can I learn from this? Well, I have to be better clinician. I have to see the patient. I have to be there I have to be there when when I'm talking to them, because sometimes you just want to see what you want to see. And that was a wake up call for me when the doctor told me, like, you have to change the way you are thinking, because the way you're thinking is really mechanical. Like, it means like you just it's like checking points. I done this, check. I done this, that, check. But in real life, it's not like that. You have to see the whole patient, and you have to use all your social skills as well, that medical school won't. They don't teach you, and the social skills I got later on was based on the life experience I had in life. I had a side job in a cafeteria, and I did some traveling, and yeah. So I think like that part was really important part of my life, because it really turned me to at least a better medical student during during my time at the medical school. Yeah, and I also think that it's okay if you fail on the finals. It doesn't mean that you're a failure, because I did fail on my finals during medical school, and they taught me in the hard way. Because I think looking back now, I know looking back now, that was the best thing that ever happened to me, that I failed on the finals in the beginning, because the transition from being what is it called in English? Because in Norwegian will be videregående skole, but
High school.
high school, yeah, high school. The transition from high school to the university is a huge one.
Yeah, I think that I'm not. I think I'm a little bit different from you. I was all the way through school. I was like reading the books from page 1 to page 150 or whatever to understand the whole mechanism. So I didn't read just the pensum. I read the whole books, so I could understand and I could do it a logical way. And during high school and earlier years, I always got it back from the teacher that I wrote too long answers because they didn't have the time to read through them. But in medical school, I got it back because then I could reason and I could do the logical thinking and find out what the patient had for a diagnosis without knowing all the symptoms or just checking out, because I had the whole picture. So I'm sort of more like the whole picture guy, even though I'm not perfect and far from. But I think that we had a little bit different approach, and I think that is important. That everybody can become a good doctors, and failure is not you being a bad doctor or whatever. Failing is just an opportunity you can learn from and become stronger. And I think that is something you need to take with you. And most of the things that I have learned later on is that you have to be sort of an actor when you are a doctor, because you need to put yourself in the patient situation and see it from their side. You have to build trust and a connection with them, because if they feel safe, they will open up and tell you what's wrong. So you sort of have to give a little bit of yourself to get that trust, and that's nothing you learn at medical school. That's something you learn from experience.
Yeah,
not only as a doctor, but as living your life.
Yeah, and it's a social skill. Yeah, medical school can't teach you. I remember we had communication groups, where you were going to have a conversation with the actor who was supposed to be a patient. But for me, it didn't work, because I knew it was an actor who was going to play a role. And I was like, okay, I can ask all the questions, but it would be like like a checklist, because I know in front of me there's an actor who's going to sit there and just answer different kind of answer my questions. And so for me, it didn't work. So the best way to develop your social skills is to meet people.
Yeah.
And you have to be engaging in their conversations. And please don't talk about just medicine in those conversations. I've been on this road before, like being with other people, just talking about dentistry things. And I was like, you know what? I'm not going to stay here for 2-3 hours and listen to your to what's going inside the mouth. I was like, okay, you know what? I want to be surrounded with other people who's talking about everything in life, about politics, about what's going on at their place, culture, different foods. I love food, and I want to try new restaurants. Like, come on, it's really important when you are surrounded with other people. Try to include them in the group, and be curious to ask them for different things, and talk about other things than just medicine. I know that medicine for us is really cool, and we can be really engaging. But please take care of those people that you are surrounded with. Maybe they don't know anything about this and they feel left out, because I have been there feeling left out, and I don't want anyone to be there. And those social skills is something you can also take with you when you're having a conversation with your patients. And that is how you build trust, like you sharing your life experience, your emotions, your feelings to them too, so they can see that you're also a human being. When you can meet them in the same level as a human beings, that's when they're actually open to you. And that is nothing you medical school they won't teach you that.
No, but and I think that another part that is important is that you need to learn and understand the different terms, the medical language, to talk to your colleagues. But you need to understand what that means in real life as well, because when you are talking to a patient, you cannot use these Latin words or medical terms. You need to talk in a way that they can understand. And many of my colleagues, they are really difficult even for me to understand, because they sort of hide behind difficult words. And I think that one of the most or the best things you can do for yourself is to just try to speak in a normal sense all the time, because then it's much easier for the patient and much easier for you.
Do you have you ever considered why our colleagues, or some of them, are using medical term to the patients?
I think that's I'm putting myself on a limb now, because I think that some of the colleagues that are using really difficult language are hiding behind it because they don't know what it means themselves. They have read the diagnosis, the terms, whatever, but they don't really understand the what's behind it. So they use these terms because they cannot find easier ways to say it. And I think the best teachers, the best doctors are those that can talk to the patients or to the colleagues in a way that a child can understand, because they really understand the pathophysiology, the underlying disease, the whole thing, because they have really gone into the stuff. And I think that's important. If you just read the examination stuff, you can only get the headlines and you don't understand what's behind it. And I think that's one of the reasons. And another reason is maybe because they feel that they are better than the patients if they talk in a difficult language.
But we are not.
No, I understand that, but it's the same like I talk to my bank guy or whatever, and he talk about things that I don't understand, or or a computer nerd or whatever talk about different stuff. I don't understand that, but that's not my interest. But they could talk to me in an easier way, and we have to think about that when we talk to the patient as well.
Yeah, but I think it's really important to think of, okay, if you and I weren't doctors, how would you like a doctor to tell you something that where you don't use medical terms?
Yeah.
When I think like it's really easy when if you are a doctor and a patient, and you seek and you are talking to a doctor, they will use the medical term. It's much more easier. But I think it's when I've been through with my parents to the doctors, like I have to explain to them in non-medical terms what it really means, and that's not always really easy. But I find it really helpful and really. It's really securing them, like they do understand what I'm talking about, and it's really important that we use simple sentences so they understand what they are dealing with, because not everyone in that room understand what we are talking about.
Another thing that I think that young doctors, medical students should keep in mind when they come into the hospitals, when they are done or on an internship or whatever, is that if you work in the ER, for instance, and there is a new patient coming to the hospital and it says pneumonia or whatever, many of the students or the internships now, they sit and read up the whole medical history for the patient before they go in and talk to the patient. I think that maybe you should just go in with clean sheets, blank white papers, and just talk to the patient and listen to what the symptoms are and what's wrong with it now. And then he can go back to the journals afterwards, because otherwise, if you have a patient with heart disease and you now comes in with chest pain, you will automatically think that it's the same as last time. But it could be something else. But if you are locked on that diagnosis, heart failure, whatever, you think that, okay, he's heavy breathing, it's water in his lungs because of the heart, you can overlook that pulmonary embolism or something like that. So I think you have to sort of listen to the symptoms, go through the differential diagnosis in your head, and then you can go and see if that fit with the patient's history, and then you can go back to the patient if there is something missing.
And I think it's really important what you telling us right now, because I've seen so many students, medical students, and our fellows, that they are just doing the thing I used to do, like a checklist. We've done this and that, and now it's time to treat them. But they don't actually think of the differential diagnosis. What kind of differential diagnosis does this patient have? And that's really, really concerning me, because working as a doctor is an art. It's not a checklist. If you think it's a checklist, then you've done it in the wrong way, because it is all about knowing the patterns, and then using your knowledge, your skills to get closer to the diagnosis. And then you have to think of, what can I do to help this patient here? Do we need to do further investigations? What kind of treatment do I have to do now? Because what medical school didn't teach me at that time was, okay, you learn about how to treat, for example, heart failures in the ER, but they didn't teach us like what kind of treatments are you going to give to them right now, and is it one size fits all, or is there any rules here? every patient is different.
Yep.
And it's not in the textbooks, and that is what makes it more difficult and
more interesting.
Yeah, and more interesting, really interesting, and some of them has really a lot of diseases that makes it more complex, because when you read the books, it's about one disease, just one. But when you have a patient in front of you with multiple diseases, how are you going to do this? Because there's a lot of mechanism that can happen if you do this or that. So what is the right choice? I think in medicine, there is something that is more right to do, but it's not wrong to do the other ones as well, but I think it's more like you have to discuss with your colleagues as well, because there are some times when I think, okay, I think this is more complex than I think. I have to discuss it with one of my colleagues, and that is how it works in real life. We do have a lot of discussions in between to help the patients, because one patient is different from another.
Yeah, and I think that sometimes or most times the most probable cause is the right cause, and then you can start to treat that. But if that treatment doesn't work, you have to look for other things, and sometimes you are stuck, and then you always have the possibility to call a friend. There are other colleagues that are more experienced, smarter, have seen more, have more experience in some other areas. So you always have the possibility to get help. And I think that most of the important thing that I know is to know my limitations. I know when to ask for help, and I'm not afraid to do that. And I think that we need to be better on communicating, talking to colleagues, talking between the different specialities.
I agree.
Because as the population gets older and older, the patient have more and more diseases, and you cannot only treat the heart failure without looking at the lungs, the kidneys, the blood. You have to see the whole picture together. And as a hematology specialist, I don't know everything about the heart or the lungs, so I need to call my friends.
And I think it's a really important message to everyone, for us too, that we can always seek for help, and we're always there to help each other, because that's the only way to improve ourselves, so we can also provide the best care for the patients. Because if we don't do that and we just go in solos, I don't think that is not a good idea. No. And that is something I missed in the medical school. I wouldn't say I felt alone, but it felt like you were just living in the bubble. Like you felt, I have to know everything on my own. But in reality, we're a team. We are working as a team. We're not... when we're working as a team, that's when the best results will appear, right?
Yeah, and you have to remember, the one that knows the patient best is the patient themselves. So if the patient tells you something is wrong, it usually is something is wrong, even though you don't find it at the first glance. So listen to your patient as well.
Yeah. So how would you summarize this episode, Eirik? Like the important message?
I think that the most important thing you need to take with you from medical school, and that we have to remember, is when you are finished at the medical school, you probably are at the top about diagnosing the patients. You just lack experience. You have read about all the diseases, all about the organs, all the different specialities. You know more than a specialist working in 30 years as a heart surgeon, because they have only done the heart surgeon. They have forgotten all about the lungs, the kidneys, the head, whatever. So when you are a new doctor, you are on the top of the wall about knowledge. You just lack the experience. So then you have to lean on your elderly colleagues and get all that experience they have, and ask for help if you need it.
And rule number 2, always be nice to every health workers, especially the nurses, because they are your best friends.
And they can help you a lot.
Yeah, and actually, they are actually protecting the patients from the doctors somehow. Sometimes, but what is important? Just be humble, be gentle, and always seek for help when you need it, because we're always going to be there.
And be a team player.
Yes, team player is the word today. So thank you for listening to this episode. So I hope you will join us on the next one.